is an antimicrobial resistance, which is a global problem. For example, like to understand for a non-medical person what is AMR is, when you take one kind of a medication to combat infection, the infection can be because of the bacteria, can be because of the virus, can be because of a fungus. So when you take a medicine for any set of these infections, and that particular organism, that particular bacteria or a virus is not responding despite the medicine is given correctly at a correct time and correct dose, this is called as antimicrobial resistance. This is a very important approach. It requires help from everyone, including from the doctors as well as the common public who is taking the medicines. So first important thing I will say to prevent antimicrobial resistance is keep your vaccinations up to date. Vaccinations are not only for kids, vaccination also for adults. So if the vaccinations are up to date, the people will fall less sick and they need to take antimicrobials less frequently. Second, I will suggest washing hands is also very important thing to spread infections, not only in the house but also in the hospitals. So we also as a healthcare professionals follow a strict hand hygiene policies. I'll urge all the people to follow hand hygiene or hand washing very diligently, because it spreads infections like diarrhea, dysentery. Also it reduces the spreads of common flus, influenza. So washing hands at a regular interval, definitely before eating and coming, if you're working, going to the hospital visit, after coming back from the hospital, definitely will help. Third very important point is taking the antimicrobial or any medicines which are given by your physician, completing the course correctly. I think that will help to reduce a burden of antimicrobial resistance, because if you take the medicines properly, the cross resistance or resistance which is developing across the community also will reduce. For a common public, I think these 3 steps will definitely have an impact in reducing the antimicrobial resistance across the country and the globe.